Hello everyone, welcome back to my channel. So this video is on what palliative care is, because there are many misconceptions regarding what palliative care is. So basically what it means is something that we are trying to provide some comfort care to the patient. It is mostly about symptomatic relief. There are many people who think that palliative is just dealing with end of life care counselings, and then trying to make sure that the person dies safely. But that is a little part of it, not little, it's a major part of it. But apart from that, when does palliative care start? So it starts with any person, any patient who is with high symptom burden. That is, say suppose if person is in the beginning of the illness, it doesn't always have to be cancerous, it can even be non-cancerous as well. So anyone in the beginning of their illness trajectory, palliative care can start, because the moment it starts, it always tries to provide comfort to the patient's life, and that is what palliative physicians as such do. And it is more like a patch fixing, trying to provide that adequate symptom relief, and trying to add in some life to the last days of life. And we, apart from doing that end of life care, accepting dying and death as a normal process, trying to provide that bereavement support is something which is a major part of palliative care, where not just doing with treatment or treating with medicines is something that we do. It is something much beyond that, where palliative always works in conjunction with a strong nursing backbone, and also physiotherapists and stomach care people, and we have many rehab people coming and working along with us. You have the head and neck rehab, or the speech therapist, the play therapist, and all of them, they come into play. And it is not pertaining to a particular age group, because it extends right from childhood till the geriatric. So it covers a wide range of population, where you get to read not just the medical conditions also, but post surgery, if the person is in need of some palliative care, if he has any needs, that is something that we have to address accordingly. Say suppose in a non-cancerous case, especially in a pediatric age group, we have many non-cancerous there are several non-cancerous conditions that we deal with, mostly like laryngomalacia or TB meningitis, more common, and also patients with intractable seizures and completely spastic musculoskeletal disorders. These are the ones that are more in need of a pediatric palliative care. And coming to the adult, we have we can divide it into two major chunks. One is the cancerous and non-cancerous. So in a cancer setup, especially right now, it is in high need of a palliative care, where it begins right at the time of diagnosis. Say suppose a patient with a lung cancer, providing early palliation has proven very good treatment outcomes, because it is not just the treatment that is going on, it is in conjunction with a palliation. So because pain is one of the most common symptoms that anyone, adherence with the treatment, pain is one of the most important things. And we ourselves trying to be the pain is one of the most common symptoms patient comes to us, and we as a palliative physicians try to ease their pain. And we are the ones who are authorized to prescribe morphine. Any registered medical practitioner can do prescribe, but its prescription and procurement needs proper training and usage. So that is something that we need to learn. Apart from providing palliation, interventional procedures are something that we have to look into, because there are several good hospitals around there across India, which are providing palliative services, and you can check them out. But this video is primarily based on what palliative care is. It is something that you try to add in some life to the last days of life, try to give a comfortable form of death, trying to ease out their symptoms and make them try to live as normal life as possible. If they are facing with certain symptoms, we try to ease them out. It is not like tell. It is more like ask, tell, and ask. That is how this branch is, and where you need to have a lot of patience internally, patience to listen, comprehend what the other person is going through. Beyond sympathy, there is something called empathy component that is here, where you try to be in the shoes of the opposite person and then see the situation. And compassion is beyond sympathy and empathy. So people who are compassionate, this is something for you. If you love helping out people, if you are someone who wants to spend time with your patient, give that extra 10 seconds of time. Of course, palliative demands more than 10 seconds, but still, where you are pretty much patient and try to help people out, and you want to like do a lot of service, which is, this is so much service oriented. This is not a branch where you can take like, you think you might get the seat just because you might get that seat. This is not something that you can opt it easily, because you need to have a strong heart, something an empathetic heart. That is what I would want to say. A lot of patience in listening, because listening is a major component in this. And as I said, if you are someone who wants to take this branch just because you're getting it, you might not be able to survive it till the end of 3 years or beyond that, because choosing a branch is something that stays with you forever. So think twice before you take it, and talk to people around who are into palliative department. And we do good things where people are pretty much happy with the kind of work we do. There are a lot of blessings, a lot of smiles you spread everywhere. People are very happy with the amount of service, or the how heartfully you do it and how heartfully you pour into this branch. That is one of the best aspects. It gives you an immense job satisfaction, where you can see a smile on the patient's face, where you help in making them more compliant with the treatment, and try to give them a listening ear. This is something that is one of the blissful parts of this branch. And also trying to provide a dignified death. That is what the major part of palliation is, trying to provide that comfortable respect during the end phase, where a patient is treated as a person, a patient is treated as a human, rather than seeing them just as a patient, trying to understand from their point of view. And it is not just, this case, what are you talking, oh, this case, this is a CA lung, this is a CA breast case, or this is a CA cervix. This is not something how we deal with. We try to talk to them through their names, and where we try to give them their own identity apart from just disease names, and trying to treat them with immense respect. That is what I've learned in this branch. Because a disease not just affects a single person, it affects an entire family. And the death of a person, even though if it is comfortable or painful, the death always stays in the eyes of the attenders, the eyes of the people around the dying person. And it's very important that we try to give them a respectful and dignified and a comfortable death. That is what I feel, and I think we are doing our best job in trying to provide that dignified death, and trying to ease their pain, and trying to listening to them, trying to provide that little bereavement support after that, trying to be more humane, and trying to understand things from their perspective. And that is the good side of it. And the sad part of it is as well, because it is something that takes an emotional toll over you, because you go to your ward, and every other day or every day you wake up to see people dying. And that is one of the saddest things, even though you know that you cannot do anything, because this is not something that is curative. We only try to palliate, where we try to ease their symptoms out, as I already told you. So you see people dying around you, and it is inevitable to stop their death, despite knowing that your treatment is not going to save them from death. But the one plus point is that it is not going to make them suffer. That is one of the biggest part. That's the biggest part in this department. And having that healthy environment around you is very much essential during your course study, apart from talking to patients, listening to them. And it is so much of a conjunction branch, where you have to read from pediatric to geriatric. It's like you need to learn about everything, but you don't get to implement everything in your practice. Okay, that is how it is. But the subject itself is pretty beautiful, but the amount of reading you have to do is quite extensive. And coming to the job opportunities, they are endless. And right now in the India, under the program of National Health Mission, NHM, the central government has announced some funds to the respective state governments to implement palliative care centers in every district hospital. So currently in Telangana, there are 33 district hospitals that have started palliative care centers, exclusive palliative care centers. When we hear about the word palliative care, it always strikes us back to Kerala or Maharashtra, which are advanced in palliative care, where it is more like a community setting. But here in Telangana, we are trying to train the doctors by experienced people in palliative care, and I think this is one of the only thing I think one of the best foot forward that the government of Telangana has taken in implementing and trying to train the doctors and nurses exclusively in palliative care for exclusive intense training for a single month, and followed by trying to procure morphine or any other narcotics in their own respective districts. So this is at the district level, and apart from doing that, they're trying to have home care visits and hospice care. So there is a difference between hospice and respite care, which I think we'll be dealing in the next topics or the next videos if you wanted to have more in depth regarding what it is. So right now the opportunities are pretty much good. There is no saturation, and you will be treated with respect wherever you go, because it is a respectful branch and you get your sense of satisfaction at the end of the day. That is what I feel. Coming to your earnings, it is on par with any other branch, but not as much as the top clinical branches or the surgical branches. But you get paid enough to lead a comfortable life. That is what I say. But the amount of a respect that you get is, I cannot say in words, because it's something that you have to experience. And if there are any more doubts, please let me know in the comment section below, because it is not that I want you to take up this branch. It is just something that I want you to be aware of what this branch is and what we as a palliative physician try to help people. Thank you. Just let me know if there are something more you want to learn.